So when medications and lifestyle or behavioral changes meant to encourage weight loss have been unsuccessful, and when severe obesity is present, bariatric surgery is often the most effective treatment option for even youth with obesity. In addition to helping a child lose weight, we know that these modern operations for severe obesity can quickly reverse obesity-related health complications like diabetes, sleep apnea, cardiovascular diseases, and fatty liver disease. Still, there's a lot to consider before deciding if a young person is a candidate for weight loss surgery. We consider the child's age, health issues associated with their weight, and how important their weight problem is to them. We also want to make sure the patient is in agreement and following a treatment plan after surgery. We want our young patients and their families to actively participate in the weight loss journey and, of course, fully comprehend the procedure and the demands of its recovery.
There are many steps a young patient and their caregivers or family must take before undergoing bariatric surgery. The reasons for this arduous process are we need to ensure the patient is in the best position, physically and mentally, to get the best possible outcome from the procedure. All patients go through at least 6 months of lifestyle and behavioral treatment and counseling before the surgery. During the 6 months, patients are required to see us each calendar month. This length of time is required by most insurance companies and also provides us a great opportunity to optimize health ahead of a major operation. During the 6-month period, the patient will meet with medical providers like me, a dietitian, a psychologist, and other health professionals. We'll work on making changes that can treat obesity, improve their health overall, and kickstart weight loss. In addition to working on changing lifestyle habits, during this time, we're also evaluating the patient for medical conditions that could be associated with their weight or even driving rapid weight gain. Knowing about these things helps us put the patient in the best possible position to have a successful and safe procedure if they decide to move forward with it. There are many reasons a young person and their family considering the procedure may decide to not pursue it or would be recommended not to. The procedure could be harmful to young people with an unmanaged mental health issue, especially with some types of eating disorders, or with active substance abuse. For female patients, they must not become pregnant within 2 years of having the procedure. And finally, there can be other reasons that it's not the right time for surgery. A young person must be motivated and focused if they choose to go through with surgery, and they must be committed and engaged in working on making changes in their day-to-day lives that are important both before and after the procedure. Our pediatric psychologists can help determine if surgery is right for you and when the right time is for a young person to have this procedure.
I've led teams studying the effect of the procedure on adolescents for more than 20 years, and here's some of what we've learned. Patients who undergo the procedure typically lose about 20 to 30% of their weight in the first 2 years following surgery. Most patients successfully keep the weight off, but for some, there is regain of some or all of their weight. Major health conditions such as type 2 diabetes, sleep apnea, fatty liver disease, and others are reversed, and sometimes this happens very quickly as well. Having the operation in the teenage years more effectively reverses the illnesses and conditions associated with obesity than waiting to have the surgery as an adult.